Hello and welcome to Joy in Our Town. I'm your host, Tammy Jo Johnson. Joy in Our Town brings you the issues and problems that are faced in the local community with the hope of finding a solution. Our guest for this segment is Celeste Nichols, Placement Unit Supervisor for the Licking County Job and Family Services. She is here to address the growing issues regarding babies being born into addiction, along with the risk associated with abusing opiates during pregnancy. Thank you so much, Celeste, for being here with us today.
Thank you.
So before we jump into our topic, tell us a little bit about yourself and your position with the Licking County Prevention Partnership.
Our agency has a membership with that partnership.
Okay.
The Director of Children's Services at Job and Family Services, Kim Wilhelm, asked me to come on her behalf. Okay. She's actually been a part of that prevention partnership since before it really was the prevention partnership. She started with the task force for prescription drug prevention. And when that task force completed its goals, the people that were part of it decided that there was more work to be done in the county, and that's when the prevention partnership began.
Wow. There are a lot of powerful partnerships being, formed here in Central Ohio. It's an amazing thing. Today we're talking about babies who are born into addiction. Yes. They develop something called neonatal abstinence syndrome.
Yes.
That's right. Can you tell us what that is?
Well, in short, it's withdrawal. It's withdrawal in the baby. So if you can imagine what you've heard about adults going through withdrawal, now we're talking about a newborn infant going through withdrawal.
Wow. And it's unfortunate because they can't even communicate that that's what they're going through.
Right.
So how does that happen?
Well, anything that goes into a pregnant mother is going to pass through the placental barrier, and the child is going to experience that too, whatever it happens to be. The way that medical professionals determine that a child actually has neonatal abstinence syndrome is with a checklist, actually. There's a scale that they use, which is commonly referred to as the Finnegan scale. I guess that might be who created it, yeah. And with that scale, then they look through the symptoms that they're seeing in the child, and they check off. It's quite a long list, and I'll be happy to tell you what some of those, symptoms are too. Once they've checked off those symptoms, then they come up with a score, and that's a part of determining whether they're going to say, yes, this child definitely has neonatal abstinence syndrome.
Wow. The symptoms that you're going to check off on, they're not associated with other things that can make it confusing, are they?
Yes, some of them are. So the reason they have this, this kind of score sheet is to determine if there are enough of these symptoms to blame the opiates then, basically, or the withdrawal from the opiates for as the reason.
Okay.
I brought a piece of paper because there are so many of them that I need a little bit of help with it myself. Okay. One of the things that we see quite often is a really high-pitched cry. Okay. It's not a normal newborn cry. It sounds strained, and it can be really quite irritating to the adults and children, everybody around the baby.
Okay.
The child can be hard to get to sleep, or they may actually sleep a lot, or they may have trouble staying asleep. So any of those kind of sleep disturbances can be an issue. Often they'll have diarrhea or very frequent stools, a stuffy nose or sneezing. As you can see, those are common symptoms. Anybody might have those. One thing that really stands out is tremors. Often the infant just sort of shakes every once in a while. It can be as severe as seizures, but more commonly it's just these tremors. And you might see it first in their extremities, but it can be the whole body.
Okay.
Another thing would be what we refer to as myoclonic jerks, which I think that just means the muscles are so stiff that they're jerking sometimes.
I see.
Often these children have feeding problems.
Okay.
They might have what we call a disorganized suck reflex, and so they may be trying to suck but not actually be able to get food through the nipple of a bottle or however they're being fed.
Wow.
So that's really hard.
That's a lot, and that happens. Now, just to backtrack just a little, is that as a result of the mother taking opiates?
Yes,
Okay.
it is. I think it has to do with how the reflexes are impacted when the mother has been using and when it actually affects the child. These children also often vomit. They sweat, have a lot of sweating. They may be cranky or restless. And the one thing that we see that is not always, people wouldn't notice that that's what this is, but it's one of the things that's most upsetting to the people that I work with, is a really severe diaper rash. It's so severe that we call it excoriation. The skin is excoriated. Okay. And the problem is that the acids that are in the drugs that they've been subjected to are really trying to come out of the baby's body. So I don't know if it's really sweating, but through all the different ways that their body, sweating and urinating and defecating, all those things, it's trying to get that drug out of their system, and so then it's damaging the skin while it's doing that.
And that's so sad, because these babies are helpless, they can't talk, and they didn't ask for that,
Absolutely.
So with the mom, opiate abuse is become an epidemic. How prevalent is that here in Central Ohio?
Well, it's a very big problem in Licking County. Most of the research that I've looked at, the articles that I've looked at, indicate that Ohio is actually one of the most impacted states right now. Licking County, for example, we have 366 children right now who are in foster care total in our county, and 28 of those who are infants are have been affected by the drug use of their birth mother. Wow.
So are you finding that the cases are coming from direct heroin abuse or prescription drugs?
It's really a combination of those things. Okay. A lot of them right now are heroin, directly heroin, but one thing that if you get involved with the addiction community, what you find is that someone who has an addiction is going to take what they can find that will keep their withdrawal symptoms at bay. So usually we have what we call polysubstance users, which just means that the substance abuser is addicted and is using whatever that person manages to get. But heroin is extremely inexpensive relatively right now. And the state of Ohio a few years ago made a really concerted effort to deal with the pain pill problem that we were having. They did a really good job of that, and so now people can't get pain pills as easily as they used to, and they find that heroin is a replacement for that.
Right. And we still have work to do, because even though they can no longer have those medications as easily, they're still out there in bundles.
Yes.
So we still got cleaning up to do, and it's unfortunate that babies have to, this is affecting them like that. So what are the treatments that take place?
Well, there are a lot of medical things that still need to be done and figured out in regards to that. Sometimes the hospitals are putting babies on methadone, actually, and then trying to wean them off the heroin at the hospital. Some babies are staying in like Children's Hospital or whatever hospital they may be at. They're staying there for up to 6 weeks to try to get them weaned off the drug that they're withdrawing from. Sometimes doctors are using phenobarbital. So there's a number of different pharmacological drugs that they might use, medications they might use for it. What my folks are trying to do, because I run the foster care program at our agency, we have foster parents who are dealing with these children, and what they're trying to do is provide parenting that soothes the children and deals with the symptoms. They're, of course, following whatever the doctor's orders are in regards to the medications and things, but...
And that makes a lot of sense. With you being, in that realm of foster care, explain to us, later on down the line, how does this affect them as they get older or become teenagers?
Well, what we find is depending on the amount of drugs that were used and when they were used during the pregnancy, different areas of the child's development are impacted at different times. It certainly can impact their learning. Certainly the fact that these babies have feeding problems can impact them into the future too,
right.
Whether it's directly from the drugs or not. So we're finding that there are often behavior problems, difficulties with socialization. The children continue to struggle with soothing themselves and learning how to calm themselves down. So it's a lot of work to parent these children.
And I would suspect that it's a lot of work, especially if it's not their child, if it's a foster parent or another caregiver. So my question is, and you may or may not be able to answer this because it might be a legal question, but if a baby is born and they are diagnosed with this syndrome in the hospital, but the mother has not been known to take these drugs or have this issue, does that now put her in some type of trouble?
Usually what happens is that if the mother's not known to have it and it's not obvious to the hospital staff, then they probably still are not testing them to see if if the mother is using any drugs. In those kinds of circumstances, Children's Services most likely doesn't get called at that time.
Okay.
We might get called later down the road if the mother continues to be neglectful of the child.
Okay.
If the problem is that because this is withdrawal, the symptoms sometimes don't show up for 3 to 7 days after the baby's born.
Okay.
So the hospital staff may not catch on.
Right. And that makes sense because a lot of the symptoms, when you first started naming them off, it sounded like colic almost.
Absolutely.
Wow.
Absolutely. So it's when that drug starts leaving their system. We've had a few children come into our foster care system recently who were almost a year old, and we might have known drugs were the issue at this time, but we didn't know when the baby was born. It didn't come to our attention at that time. And we've had a couple of situations recently then where the baby's going through withdrawal after the child's gone into foster care. We're trying to help the mother deal with her addiction issues, and suddenly we realize that, oh my gosh, she's been breastfeeding this baby.
Right, all the time.
And so now the child's just now going through withdrawal.
Wow, and unfortunately we're out of time, or we would sit and talk about this forever, but thank you so much for just the information that you provided us starts the conversation, right?
Yes,
Thank
absolutely.
you so much for
and
being here with us
Thank
today.
you very much. I appreciate it, and
You're
I
very
hope the
welcome.
conversation can continue.
Yes, thank you.
Thanks.
Coming up next on Joy in Our Town, bullying. Stay with us, we'll be right back.